Hello everyone, welcome to the another episode of Platform for All podcast. Today we have a very special guest with us whose name is Dr. Bhoomi. Hi Dr. Bhoomi, how are you doing?
I'm good. Thank you.
So Dr. Bhoomi, can you give a background of yourself? What expertise you are in exactly?
Sure, doctor. Currently, I am working as a cardiovascular and respiratory physiotherapist. So, I'm currently practicing in Mumbai.
Oh, that's great. So what exactly do you do in cardiovascular physiotherapy?
So, in cardiorespiratory physiotherapy, what we do is that we train individuals who are interested in fitness. So, we have an overall data about their current BMI, their intake, their output, their physical activity levels, and then we modify their physical activity levels according to their current functional capacities, and we design some fitness protocols for them.
Oh, that's really good to know that you are associated with the fitness industry. So the today's topic is also about the fitness. So like in general the topic is about the prevalence of heart attacks in younger population. So doctor, can you just give a insights about why today's generation are so prevalent for the heart attack? Why they are getting so much of heart attacks into their day-to-day life?
Sure, doctor. This is a very great topic and a very good and upcoming problem that we can discuss on. So, as we are seeing that cardiovascular problems, lifestyle disorders, heart attacks, these all things are increasing day by day. And previously, it was that only the people above 50 years or above 52 in the range of 50 to 60 years were suffering from these problems. But nowadays, the younger generation is going to have a major setback because of this current issue.
So, doctor, what factors, according to you, contribute to the rising the prevalence of heart attacks in young individuals in recent years? So, what is your take on this?
So, what is happening is that in the past 20 years, there has been a surge, a very big rise in the cases of young individuals having heart attacks. So, previously, we used to hear that only 50 years के ऊपर अगर आप हैं या 50 to 60 के बीच में अगर आप हैं तो आपको heart attack होगा. But nowadays, young population, young generation में भी ये problem आ रहा है. So, one of the main culprit cause of this is obesity and poor dietary habits. So, पहले क्या होता था? पहले we used to, there was a lot of physical activity which the previous generations were doing, but nowadays we are so busy, so engrossed in our jobs, in our work, that we hardly find some time to exercise. One problem is that. Other problem is that, so lack of exercise is building up the obesity thing. दूसरा problem क्या है कि our poor dietary intake, food habits. So a lot of amount of food what we are consuming is junk food. So पहले क्या होता था? पहले previously the things, everything was not readily available. So people used to rely on home cooked food, on natural fruits and vegetables. So पहले कैसे होता था? Good amount of food intake, good quality food was being intaked by the people. But nowadays a lot of processed foods are available, a lot of preservative rich foods are available, and a lot of foods which are like ready made are available. Online के आने की वजह से these foods are readily available at your doorstep. You can just order them, easy to cook, easy to eat, not having much of work to be done. So these foods are actually building up the bad dietary constituents in our body. So these food जो ये intake है, it is increasing. We are loading ourselves with unhealthy foodstuffs. So fast food, junk food, all those things are affecting us in a bad way, and that is leading to obesity, which we know is a leading cause of cardiovascular issues.
Are there any other factor which also lead to heart attacks in younger population?
Yes, definitely. The second most important problem is of addictions. So, as we know that much of our younger population and the younger youth finds it very difficult to cope up with stress. So, we all have some or the other stress in the life, stress of personal life, stress of relationships, stress of jobs. So, what happens is such multifactorial stresses often will lead a person to use of like alcohol, cigarette smoking, tobacco use. So what is happening is that all these things are not at all good in the longer run. So cigarette smoking, tobacco chewing, consumption of alcohol, these things are very bad in the long run. They will cause a lot of circulatory disturbances, and they can lead to not only heart attacks but also brain stroke.
So rightly you said about the addiction part, doctor. So are there any specific risk factors or lifestyle choices that you believe play a significant role in the development of the heart attacks in younger population?
Yes, definitely. There are a lot of specific risk factors which our younger generation are is following. And talking about lifestyle choices, one of the major problem of the day is binge eating.
Hmm.
So I have, met a lot of people which tell me that, they have this anxiety problem. Anxiety is common in today's world, as we have a lot of competition. I can understand that. And the goals which we are setting for ourselves, the goals usko, the constant urge to meet that goals is there every day. So these all things can definitely lead to anxiety in any person. But the thing is, our coping strategies are at fault. So what people think is that whenever they have anxiety, they if they eat something which will enlighten their mood, which will freshen up their mood, they will start feeling better. So according to research, it is said that whenever a person is feeling anxious, they will start binge eating on something which is very sugary in nature. So a lot of, like, your dessert foods, your ice creams, those kind of foods which are, which will relish your taste buds, those kind of foods are consumed by people who are having a lot of anxiety. So that is one thing. Next, your high energy foods, like, your sodas, your drinks, your fast foods. So those kind of foods, high energy foods, when you start consuming, you have a lot of dopamine rush in your body, and that ultimately is going to, stabilize your mood. But problem tab aata hai when this particular habit becomes a pattern, and the person starts following that pattern on a regular basis. So something on the other here and there happens in work life or in personal life, the binge eating is started, and that can very badly affect your LDL cholesterol levels, which is a main culprit in development of cardiovascular issues.
So what do you mean by LDL cholesterol levels?
So as we know that in our body there is something called as a total cholesterol level, something there is called as an HDL, which is a high density lipoprotein, and something called as LDL, which is a low density lipoprotein. So what happens is that this HDL levels, this is also called as a good cholesterol, and the LDL is also called as a bad cholesterol. So the HDL levels, if they are at a rise, it's not a problem. But if your LDL levels are on a rise, it is very, very bad for your heart in general, and also the arteries supplying it. Because what happens is that in your arteries, in simple words, I would like to say your blood vessels, the vessels which carry blood to the heart, which supply the heart, in these arteries and blood vessels, there are going to be cholesterol deposits. And these cholesterol deposit, this low density lipoprotein deposits in your arteries, are going to clog them. And once these arteries are clogged, they are blocked, the blood supply to your heart is cut off, and that is what leads to heart attack.
So, doctor, previously you mentioned that people who don't exercise or people who don't work out, they are very prone to heart attacks. But what about the people who are exercising regularly and they do a lot of workout? Even those people are getting heart attack nowadays. What do you suggest or what is your insights on that?
Yes, this is another major problem, that people who are doing a lot of workout, in fact, many people during the workout, as we know, as we are seeing that in the gyms also, during the workout, people are suddenly having cardiac arrest. So one major problem which is causing these incidents is that lack of warm up. So these people, they do not have a proper warm up. They miss out on certain important steps of warm up before the exercise, that can lead to a cardiac arrest. Secondly, these people nowadays, there is a lot of trend in increasing your caffeine intake. So many people say that, before workout you should drink a cup of black coffee, that is going to, help you lose, help you, shed your weight faster. So what is happening is that excess of caffeine increases your adrenaline levels, and this again can lead to a lot of cardiovascular problems. So if we are focusing on our physical health, if we are going to the gym, if we want to stay fit, we should also be well aware about the form of exercise we are doing, what precautions we should take, and what are some of the do's and don'ts when you are doing the exercise in the gym. So this if this all these points are followed, the people who are working out in the gym, people who are regularly going to the gym, exercising, who are appearing to be fit, those people will never suffer the problem of cardiovascular issues.
So that's a beautiful point which you have mentioned, doctor. So coming to our next question, could you explain any potential challenges in diagnosing heart attacks in young individuals?
Yes, definitely. There are a lot of potential challenges. One of the main challenges and the main difference in the symptom and the presentation in older population and younger population is that, like, see, if older population is going to get a heart attack is never a single episode. Okay, previously there are many episodes, there are many trigger warnings in the form of chest pain or exertion. So whenever the patient does exertion, okay, exertional activity, there is chest pain, there is minor chest pain which we called as angina. So angina jo hai, it is when it is experienced by a person who is old people, as we know that they may not do a lot of work as compared to younger individuals, physical work. So they are almost at rest, okay, sitting in one place or resting, and then suddenly they have this physical, they have this pain on exertion, okay, and then they understand that something is wrong with the body and they will immediately report it. But on the other hand, younger people, okay, young population, even if will experience a pain of this sort, then this is a very typical and very peculiar pain. It will radiate to your jaws, it will radiate to your shoulder. So what they may think is that it is just a pain of mechanical origin. So they may just apply some balm, or they may take some tablet or analgesic, they will take a power nap and it will go. So this delays the diagnosis and it worsens the condition. So this is a potential challenge when it comes to awareness, self awareness and diagnosis. And also many people will never believe that they are experiencing something called as heart attack, because they may claim that they are very young for it. And also many times young people may get misled. They may think that this pain is due to some indigestion, or the pain is of gastric origin, so they may neglect it. This is a potent challenge compared to old age.
That's a very beautiful information which you have given, doctor. So can you throw some light on what symptoms a patient or a person will feel while having a heart attack, basically?
Yeah, so the symptoms of heart attack are very peculiar, and they are like a very different kind of symptoms which a person will feel. The very first and the pronounced symptom is going to be chest pain on exertion. So whenever the patient is doing, so exertion, I not only mean physical exertion, even sometimes the mood is elevated, excitement, joy, anger. So these are like extremes of your mood. So where your emotional aspect is on a higher side, that time also the angina can be triggered, as well as sometimes when there is a lot of physical stress, where there is a lot of physical exertion, or sometimes when there is a lot of mental exertion like anxiety or maybe a deep sorrow. So these things, which are some common factors, are going to trigger your chest pain. Chest pain is of very peculiar and very particular in origin. It is going to be like a stabbing pain, as if someone has stabbed a knife onto your chest. It is going to be that kind of immense pain, and that pain will radiate. This radiation word is very important. That pain will radiate to your left jaw, to your left shoulder, and your left upper back. So any pain which is not stationary, keeps on migrating, and it is very dynamic in nature, can be attributed to chest pain due to cardiac problems. Secondly, there is going to be breathlessness. By breathlessness, the patient will say that meko saans nahi aa raha tha, I was running out of breath. So a lot of effort to breathe, gasping for breath, is going to be something which is present in patients having a heart attack. And third is profusely sweating. Sweating is going to be a profuse sweating response is going to be present in that patient. So all these things, whenever, it is not only important for the patient to report these symptoms, but also the patient's relatives and someone who is accompanying the patient to be very vigilant about this. If any time you see such symptoms occurring in a person, you should immediately report it and get the person admitted to a proper healthcare facility.
Thank you so much, doctor, for giving us a life saving tip for me and as well as for our listeners. So, coming to the prevention and awareness side. So, doctor, what steps can young adults take to reduce their risk of experiencing a heart attack?
Yeah, so there are certain points where one needs to focus. We highlighted certain risk factors. So these risk factors, if you potentially make some lifestyle modifications, you will be successfully able to combat these risk factors. So सबसे पहले है to maintain an ideal body weight, to maintain an ideal BMI, okay, to maintain to consume food, and to have a habit of doing regular physical activity. So all these things, if are followed properly, also talking about addictions, one should minimize or stop addictions. Like I always mention, if you are smoking, quit smoking. If you have alcohol consumption, just quit it. If you're not able to quit it at one go, quit it, slowly start tapering it off, because these things have never been good for the health. So if we make certain small lifestyle modifications, if we just develop a habit of having healthy food, if we develop a self control of stopping ourselves from eating junk food, from consumption of alcohol, from binge eating. See, there are many other ways to cope up stress. If you are anxious, you can always switch on to meditation. If you are experiencing some kind of emotional problems, you can always try some behavioral strategies, some behavioral therapies, some meditative strategies. So there is always a solution. Talking about lifestyle modifications, they are the need of this hour. So if you are able to make some certain lifestyle modifications in your day to day life, then that is going to be very fruitful for you in the upcoming 20 years, because heart health is equally important as physical health, mental health, and emotional health.
That's really great information which you have given, doctor. So, doctor, coming to our next question, how can healthcare providers, schools, and communities raise awareness about heart health among young people?
Yeah, so healthcare providers have a primary role when it comes to education regarding heart health. So let us take an example of physiotherapy. So we as physiotherapists, we are known for movement and fitness, and making a person physically fit. So we can be someone who is very enthusiastically educating people on maintaining their physical fitness. We can emphasize on the importance of regular physical activity. So, and talking about schools and communities, we can run various camps in schools, because when we know that these teenage population, teenage shuru hone pe hi, people are very prone to addictions and to bad eating habits and junk foods. So we can have certain awareness camps in schools and communities, where we can target the young population. Okay, we can understand and address their problems, and we can give them an insight, and we can give them certain solutions on how they can develop themselves and maintain themselves, so that they do not fall prey to this rising epidemic. Okay, so we as physiotherapists, we are a very important part of the multidisciplinary approach. So we are always working in collaboration with the physicians, with the nurse staff, with the other healthcare facilities. So it is our primary role, and we are the person, we are the healthcare providers. This is a branch which remains in very close contact with the patient, and we spend a lot of time with the patient as compared to other branches. So we have a very good opportunity to understand the patient's problems, to give them certain solutions for it, to guide them, to educate them, to use motivational strategies. So this is how we can mold them and make them understand and make them believe that cardiovascular problems can be beaten, can be ward off only if you pursue to maintain your health at a positive and a better side.
Thank you, doctor, for sharing very beautiful insights with us. So, just for going to our next question. So, doctor, how important is emotional and psychological support for young individuals recovering from a heart attack, and what resources are available in this regard?
Yeah, so talking about the psychological and emotional support, any सबसे पहले बात तो I would like to highlight is that any person who is suffering a heart attack is going to go in a state of panic. Okay, so they go into a state of panic. Most of the times they are not able to understand and register what is happening with them. Okay, there is a very little acceptance on their end that this happened at a very young age with them, and they lose the moral of life. I know many people who are young, they have suffered cardiovascular problems. And one major, along with the physical rehabilitation, what we are giving them, psychological rehabilitation, vocational rehabilitation. By vocational rehabilitation, I mean to say how fast we can make them ready to resume their jobs and all. So, those things play a very important role. We all also, I would like to highlight the physiotherapy aspect in this problem. So many people have this idea that physiotherapy is all about bones and joints. So what we do is that if someone has a orthopedic pain, if someone has a muscle spasm or a knee pain, so they have to go to physiotherapist. But the recent achievements and the recent highlights in the field of physiotherapy is that physiotherapy can work wonders in cardiovascular health. So any person, any patient who is suffering from a cardiac issue, many a times it happens that the patient is treated via non-invasive methods, okay, and sometimes the patient has to go through surgery. But in both the scenarios, physiotherapy post surgery plays a very important role. So by physiotherapy, I mean to say cardiac rehabilitation. So cardiac rehabilitation is a well programmed and a well measured approach where the particular programs or the particular protocol are going to be tailor made, that is going to differ from patient to patient. So patient centric care is available. Graded exercise testing and evaluation of the patient is done from time to time. Accordingly, the protocols are set, and according to the patient's current functional demands and current functional status, the exercises are being administered. So this was about the physiotherapy aspect of it. Talking about the psychological support, it is very, very important. It has to go hand in hand with the cardio rehab. It has to go hand in hand with the physical rehab. And not only the physiotherapist and the healthcare providers, but also the patient's family should be very keen and very equally interested about the patient's psychological and emotional well-being, because all these factors are connected, and how a patient is psychologically is going to have a very, very big impact on the cardiovascular health.
Thank you, doctor, for sharing a beautiful information. So, coming to the conclusion of our podcast, doctor, just one last question for you. Is there anything else you would like to share or emphasize regarding the prevalence of heart attacks, especially in the younger population?
Thank you, doctor. I would like to highlight one main aspect is that, and I would request all our younger populations and the middle aged people as well, that please do focus on your physical, mental, and emotional well being. It is very important, it is a need of the hour. All your goals and all your dreams and all your calculations are going to be achieved at some point of the day. एक दिन में नहीं, 2 दिन में, 1 साल में, 10 साल में सब हो जाएगा. But the very important thing is that how you treat yourself, how harsh you are on yourself will definitely have an impact on your health. So the very first thing is to acknowledge that your health is important. Secondly, to develop an insight, to develop an anticipation of how you're taking care of yourself. And third very important thing is to take your physical, mental, and emotional one being, tie it in one thread, and take care of it accordingly. Secondly, I would like to highlight the importance of physiotherapy in cardiovascular conditions. So as you know, there we need to raise a lot of awareness among the people, because physiotherapy is not only about the bones, joints, muscles, tendons, muscle spasm and pain, but it is also about your cardiovascular conditions. Any cardiovascular condition, anything which puts the patient on a bedridden condition, physiotherapists can save. Physiotherapists have an important role to play. So post cardiac incidents, cardiac rehab is a must, which is done by only a physiotherapist, a certified cardiovascular physiotherapist. And do feel free to approach a physiotherapist in your nearby area. Do have a habit of taking a proper consultation and a proper tailor made program and expertise and a scientific solution for all your problems. Thank you.
Thank you for taking the time to complete this podcast, doctor. Your insights will be very valuable in addressing this critical health concern. Again, thank you so much for joining us and keep listening to Platform for All podcast.